Hello, my
Hi.
name is Sean. I'm a nursing student and I'm going to be doing a physical assessment on you today.
Okay.
I'll be right back. I'm going to go wash my hands.
Sure.
So I'll wash my hands for 20 seconds, come back. Okay, can I see your name first, please? First and last name?
It's Asad Loya,
And date of birth.
3rd of June 1989.
Okay, so patient up here stated age. Do you have any allergies?
I don't.
Are you in any pain today?
No, I'm not.
Good. Okay, so I'm going to close the curtain for privacy. Okay, so just by talking to him and looking at him, he isn't slurring his speech, his face is symmetrical, there's no drooping, appears to have good hygiene, he's odorless, and he seems to be in a good mood. Do you know who the president is?
Yes, it's Barack Obama.
Okay, do you know what year it is?
2015.
And do you know why you're here today?
To get a physical done.
Good, so the patient is alert and oriented times 4 to person, place, time, and purpose. Alright, so let's get started. So first, I'll assess his head. So there's no lumps or lesions. The hair is dry and symmetrical. And now I'll assess his eyes. So I'm going to shine a light in your eye. Just look over my shoulder here.
Okay.
So pupils are equal, round and reactive to light accommodation. The eyes are symmetrical. So now I'm going to inspect his conjunctiva. So conjunctiva is pink and moist. And yeah, so now I'm going to go to his mouth, inspect his oral cavity. If you could just open up, please. So gums are pink and moist, uvula is midline, tonsils I give a +1, tongue pink and moist, teeth are all there, and there's no lumps or lesions. So now I'm going to test cranial nerves 5 and 7. So could you just smile for me? Show your teeth, good. Can you puff out your cheeks? Good. Okay, now close your eyes. I'm just going to touch you in a couple spots. Let me know where I'm touching you.
Left cheek. Forehead. Right cheek. Chin.
Okay, so cranial nerves 5 and 7 are intact. Now I'm going to move down to his neck. I'm going to palpate the carotid artery. Okay, one at a time. +2 and +2. So now I'm going to auscultate them with the belt of my stethoscope for bruits. Could you hold your breath, please? Okay, release. And hold your breath. Release. So no bruits noted. Now I'm going to move down and auscultate his lungs. So we auscultate them in 10 spots, front and back, 10 each. Okay, deep breath. Good. Release. Okay, so now I'm going to move to his back. Okay, you can breathe normal. Okay, now I'm going to also take the right lung. So you can lift this arm up, please. Left lung. This arm up, please. Thank you. Okay, so now I'm going to percuss your costovertebral angle. Let me know if you feel any pain or tenderness. No pain. No pain?
No.
Good, no pain. Good. All right, so now could you just bend over? I'm going to inspect if he has scoliosis. The spine seems aligned. And His AP diameter is 2 to 1. Okay, so now I'm going to auscultate his heart sounds. So starting with the aortic, it's at the second intercostal space. Pulmonic, second intercostal space. Herbs, third intercostal space. Fourth, tricuspid. And fifth, the mitral. And I'm going to hold here for 60 seconds to listen to the apical pulse. 60 seconds go by. I'm going to flip it over and listen with my bell. Mitral, tricuspid, herbs, pulmonic, and aortic. Okay. So now I'm going to assess his arms. So I'm going to feel them. They're warm, skin is dry, skin color is appropriate for ethnicity, hair is evenly distributed, there's no lumps or lesions anywhere. So I'm going to palpate his brachial pulse. So I give them +2, and radial pulse, +2, good. So now I'm going to look at his fingers, there's no clubbing, cap refill is less than 3 seconds. And now I'm going to test his grip strength. So squeeze my fingers as hard as you can. Good, okay. So grip strength is equal in both arms and hands. Okay, so now I'm going to move down and assess his abdomen. So if you could just lay down for me. Thank you. And I'll just lift up your shirt. You don't mind if I touch you or anything, do you?
That's okay.
Good. Okay, so just by looking at the contour of his belly, it's flat. There doesn't appear to be any lumps or lesions anywhere. So now I'm going to auscultate his bowel sounds, starting with the right lower quadrant. Right upper quadrant, left upper quadrant, and left lower quadrant. So bowel sounds are hyperactive. Now I'm going to palpate. Let me know if you feel any pain or tenderness.
No bad.
No pain? Good. No pain anywhere? Okay, so now I'm going to percuss them. Okay, so dullness noted. Okay, so now I'm going to name all of the organs that are in each quadrant. So in the right lower quadrant, there's the right spermatic cord, right ureter, the cecum, and the appendix. In the right upper quadrant, there's the right kidney, the liver, and the gallbladder. In the left upper quadrant, there's the left kidney, the stomach, the pancreas, and in the left lower quadrant, there's the sigmoid colon, the left ureter, and left spermatic cord. All right, and that's it for the abdomen. So you can sit up now. Actually, I'm gonna have you lay down again. I'm gonna do the get up and go test. So you can lay down and just get up on your own. Good, so he gets up on his own. He doesn't need any help. Now, if you could just close your eyes. So I'm doing the Romberg test. Let him stand there for a little bit on his own. He appears to have good balance. He's not shaking or he's not falling at all. So you can sit down again. Thank you. Okay, so now I'm going to assess his legs. Just looking at his legs, they are brown, appropriate for ethnicity. Hair is evenly distributed. It's warm. Doesn't have any lumps or lesions anywhere. So now I'm going to palpate his popliteal pulse. Go to +1 is dorsalis pedis. +1 and is tibialis. Give it a +1. Okay, now I'm inspecting for edema. Doesn't have any signs of edema. Good. So now if you could just put your feet up. So I'm going to do the Babinski test. Make a backward 7. So that's negative. Toes aren't fanning out. Toes aren't fanning out, so that's negative. And let me think here. I think that's it. So thank you for watching.